Hello, and welcome to today's webinar, the Thyroid Masterclass, presented by Dr. Angela Hywood. My name is Susie Peterson, and I will be the moderator for this webinar. We appreciate your dedication to learning and are honored to have your support for both the MediHerb and Standard Process product lines. Before we begin, I am required to read the following disclaimer. Integria Healthcare and Standard Process sponsor these webinars to provide healthcare information to practitioners and to provide them the opportunity to hear about the views, recommendations, and experiences of other practitioners. Health-related information provided here is not a substitute for medical advice. No products are discussed in this presentation. Integria Standard Process and the speaker, Angela Hywood, do not and cannot accept responsibility for errors or omissions or for any consequences from the applications of the information provided, and make no warranty express or implied with respect to the information provided. And now a few words about our presenter. Angela Hywood is an experienced naturopathic clinician with over 24 years of clinical experience, specializing in integrative endocrinology, fertility, and pregnancy care. Prior to Angela's career in naturopathy, she studied at the School of Pharmacy, Curtin University of Technology in Perth, Western Australia, and has a strong interest in herbal safety, particularly herb-drug interactions and pharmacology. Angela is a well-known speaker at complementary and integrative medicine conferences both in Australia and internationally, and has published articles in complementary medicine journals and textbooks in Australia and the United States. Angela's clinical passion in the art and science of herbal medicine, clinical nutrition, homeopathy, whole food nutrition, and lifestyle medicine are tailored into dynamic clinical programs for her patients. It is my pleasure to introduce to you Dr. Angela Hywood.
Thank you so much, Susie, and thanks everyone for taking time out of your evenings for tonight's webinar. I was absolutely delighted to be invited to speak on one of my favourite topics, which is thyroid health and thyroid well-being. I think you would agree that this is something that we literally see presented in our offices every single clinical day that we are at work. Most certainly for me. And I'm finding that I'm able to catch thyroid problems even sometimes before they're doctors do things by really looking deeply into their blood work and actually seeing what's going on with patterns and trends and being able to catch the fall before they, are diagnosed into full-blown medical hypothyroidism or Hashimoto's or Graves'. So I always say prevention is far better than cure. And it's something that I routinely check for with absolutely all of my patients, men, women, and even the little children that I see. So there's many causes of hypothyroidism. So we'll start by talking about hypothyroidism predominantly in this conversation today, mainly because this is the number one type of thyroid presentation that we will see in our office. So the most common causes of acquired thyroid disorders are iodine deficiency. Still remains the number one problem worldwide that can trigger an underactive thyroid. Reason being is iodine is the major mineral required to build the hormone T4, and iodine is predominantly stored in the thyroid gland, but every single cell in the human body uses iodine as well. So iodine deficiency just from, diet is a huge factor. And I think we'd all agree that in our Western culture, we're not good at actually even understanding. If you ask, anyone on the street, what's the source of iodine in your diet, they would have no idea. And that's because sea vegetables and such, foods are not a common part of our culture. And also our soils are empty harvest, particularly in the Midwest or what they call the goiter belt of America. The second most common cause of thyroid disorders is autoimmune disease, and this is the onflow of then Hashimoto's thyroiditis. Autoimmune disease is so incredibly complex, and there's many driving factors that can trigger autoimmune disease. one of which I'll touch on later, which is actually infection, and how infection can trigger autoimmune disease and, then the onflow of either, thyroid autoimmune or any other autoimmune in the body. So I'm going to have a look at some concepts of particular infections that have been linked to Hashimoto's thyroiditis. Then we have iatrogenic causes, radiation exposure. Now, you're probably thinking, oh gosh, that's a bit radical, radiation exposure. Well, we know that, from unfortunate incidents like the Chernobyl radiation disaster and the more recent Japanese radiation disaster, that thyroid disease has been a big manifestation of that. I look at more insidious radiation exposure, and this is, computers, cell phones, and this bombardment of ionizing radiation we get just from our environment. It's pretty intense. So I think that we need to be aware of this and aware of simple strategies to detox radiation. Now, interestingly, the major mineral our body uses to detox radiation is iodine, yet we're all iodine deficient. So it's really important that we use just simple mineral therapy, but particularly iodine, but all the other complementary minerals to help our body be protected against radiation and also repair the DNA damage and the endocrine damage associated with that. But surgery and even pharmaceutical drugs can then have an on-flow effect of impacting the thyroid and its particular sets of drugs, etc. Then we've got environmental toxicities, which is heavy metal toxicity, halide toxicity, and xenoestrogens. Heavy metals, I think we're all probably fairly aware of. Halide, the halide mineral family, if you go back to having a look at the periodic table, the halides are bromine, chlorine, iodine, and fluorine. So, if thyroid patients are brushing their teeth with a fluoridated toothpaste every day, then basically when you have a higher blood level of fluoride than you do iodine, fluoride will lock onto the receptor sites, therefore blocking good thyroid hormone production. Likewise with all the bromides as well. So we need to be doing a lot of environmental education with our patients and teaching them about these concepts, how to avoid these type of environmental toxins. And likewise with our xenoestrogens, this is our, plastics and, PCBs and dioxins and bisphenol A's and all of those nasty toxins. I know that there's been quite a big media push from the Environmental Working Group recently around all of the dangerous xenoestrogens in perfume, which I think is so interesting. So, I'd say the majority of average women around the world probably wear perfume a few times a week, if not every day. And it's the commercial perfume, which are full of toxins and poisons. So, again, it's this type of education that we need to be aware of. But xenoestrogens, particularly in women, come from, makeup and skincare and fragrances, etc., etc. And then not to mention what we're putting in our body. And then the other base cause of hypothyroidism is just good old-fashioned nutritional deficiency. And this is, a lack of adequate proteins, a lack of adequate minerals, a lack of sufficient vitamins, simply for the thyroid to do its job properly and make really good T4 and then convert that T4 beautifully over to T3. Okay, so this slide is no new news to us, but it's something I use as a clinical education tool for my patients. And this is the host of signs and symptoms associated with hypothyroidism. I can have a very thin, lean, young girl in my office in front of me who says, well, I don't feel like I've got a thyroid problem because I'm not overweight. Yet she will, have shortness of breath and she'll have foggy headedness and she'll be feeling tired all the time. But it does not always present as weight gain. Every patient's constitution is different. Their, biochemistry is different. Their body composition is different. So I think it's really good to make them aware of all the different types of signs and symptoms associated with thyroid problems. As a matter of fact, I give my patients a symptoms checklist so that once a month or so, They can go back to the symptoms checklist and tell me what's been going on for them. And of course, with treatment over the course of time, what we see is, most of those symptoms eventually resolving as their biochemistry becomes happy. So this slide I would urge you to use as a clinical tool to educate your patient about how underactive thyroid can affect their body. Now, the hypothalamic pituitary axis is an important axis, and we need to educate patients. It's just not about their thyroid, it's about their brain endocrine function as well. So we need a healthy hypothalamus, we need a really healthy pituitary. Hypothalamus and pituitary also require minerals and great protein for optimal function. So the thyroid has a profound impact on our carbohydrate, protein and fat metabolism, so how we process our nutrients, of course how we utilise our vitamins. One of the big ones, and please highlight this point, is our thyroid function is the major dictating factor for how good our mitochondria are. And there's been so much in the integrative medical circles and natural medicine seminars over the last few years, a really big push on education around mitochondrial dysfunction and mitochondrial problems. So, our modern mitochondria are suboptimally functioning, and this can be due to oxidative stress, environmental toxicities that are impacting our thyroid in a negative way and also impacting, therefore, our mitochondria. Given that I deal with a lot of fertility in my clinical practice, I almost consider that I have a mitochondrial practice because, women and our egg quality is really only as good as the mitochondrial and the DNA quality within the eggs. So I always ensure that patients' thyroids are beautifully functioning to make sure that the mitochondria's energy is being fueled optimally from really healthy T3. T3's got to get from our blood to inside the cell. And then once the T3's in the cell, it's got to lock onto the receptor sites in the nucleus and in the mitochondria. And once you get the T3 locking into the mitochondria, then you get this mitochondrial energy production going. So having sufficient intracellular, which is intracrinology, but intracellular T3 is absolutely critical. Our thyroid also, affects our digestion, our muscles, our nerves, our blood flow, our oxygen utilization. Which is another really important point. The good old-fashioned Barnes basal temperature test. Well, that's a beautiful old-fashioned, cost-free, non-invasive test to actually check about T3 function. So that we'll do it first thing every morning, body at rest, first thing upon waking, same time every day for 10 consecutive days. And men can do it anytime. But women need to do it from day 1 through to day 10 of their cycle, if they're still cycling, because then after ovulation, their temperature would naturally be higher. So just in that basal day 1 to day 10 stage. Now, if you find that the temperature is lower than 36 degrees Celsius, which I'll have to do a quick calculation and get the Fahrenheit temperature for you, then we know we have an underactive T3 or some sort of mitochondrial dysfunction going on. So go back to the simple Barnes basal temperature test as your indicator of, T3 sufficiency. And as I've already discussed, the thyroid really impacts reproductive function, pregnancy health, pregnancy outcomes, men's reproductive health as well. It's a vital part of human physiology and human endocrinology, so nothing can function properly if the thyroid is not happy. So once our thyroid produces the T4, and the thyroid gland exclusively produces T4, we can't produce it from any other gland in the body, then the enzyme called IDI needs to be produced to convert that T4 over to T3. Now, IDI is made and actually synthesized and converts this T4 to T3 in the liver, kidneys, brain, pituitary, and in the brown adipose tissue. But a majority of this conversion of T4 to T3, the majority, about 80%, actually happens in the liver. And it happens in the phase 2 liver detoxification pathway, believe it or not. So anything that you can do to support healthy phase 2 liver function and upregulation of the beautiful liver detoxification pathways will ultimately improve your T3 levels in the bloodstream. So I'm quite commonly, using, methionine and glutathione and cysteine and all of those beautiful sulfur-rich amino acids to upregulate phase 2. From a botanical point of view, I use a lot of schisandra and rosemary and turmeric to really support those liver detoxification functions, which is where you'll get the T4 to T3 conversion. But it also happens in the kidney, brain, pituitary, brown adipose tissue as well. Now, as you will see, this IDI enzyme is a selenoprotein. So in order to make enough of this enzyme, you need selenium and you need protein. And one of the major proteins when you need to produce this is tyrosine, and tyrosine is also one of the major proteins we need to produce the T4 hormone. So tyrosine is what I call, the king of amino acids for good, healthy thyroid function. So IDI relies on adequate selenium and zinc for production and activation and that major amino acid, but we want to make sure they're getting good broad spectrum amino acids. So just ensuring digestion is good, protein intake is good in the diet. Now, elevated copper is known to trigger reverse T3 production. So I always look at a copper and zinc ratio from medical blood testing, or if you're doing things like mineral hair analysis or any of those type of functional medicine tests, look at your copper to zinc ratio. The copper to zinc ratio should always be 1 to 1. If you're getting elevated copper, then you're at risk of producing this tricky little hormone called reverse T3. Now, reverse T3 is not an active thyroid hormone, it's inactive. So in a standard medical blood test, when you look at the free T3 levels, this is a collection of normal free T3 and reverse T3. So often you need to specifically request reverse T3 being done. Now, so copper excess can cause a problem, but copper deficiency can also compromise thyroid hormone metabolism. So it's really important that we look at that 1 to 1 ratio and always make sure we've got sufficiency of selenium. So free T3 directly boosts the energy metabolism in our mitochondria. T3 is a functional hormone that makes mitochondria work well. Free T3 also triggers protein synthesis and influences mitochondrial and nucleic acid gene transcription, so DNA and mitochondrial transcription. And free T3 also elevates our heart rate to meet the needs of our oxygen demands in our body. So patients with low T3 levels often get like breathlessness and this hypoxia in their body. And that's one of the reasons they feel cold all the time. So once activated at the thyroid receptor sites in the cells, the thyroid hormones combined to our DNA and trigger gene transcription. And this is why having a good, healthy thyroid function is absolutely critical to reproductive health and well-being, not only of women, but for men's sperm DNA replication as well. And interestingly, the position of the thyroid receptors attaching into the DNA can facilitate copying of some genes, but blocking other genes from being copied. So this is where we come down to epigenetics. If we have healthy thyroid function, we're less likely to have genetic defaults or defects, which is coming into the realms of SNPs and genetic medicine, really. Okay, so here is a lovely educational graph or illustration of the hypothalamic pituitary thyroid axis. And this is one that I go through with my patients because I am honestly a little aghast a lot of the time of seeing a patient come into the office, they're on thyroxine. So, T4 medication is prescribed by, a doctor prior to seeing me, and they've got no idea what this is. They don't even know it's a hormone. They don't know why they're on it. They don't know how it works in their body. or they come in thinking that it is the magic, the magic pill that'll solve all their problems. So thyroid replacement therapy, or T4, is just the hormone T4. And as you can see here, our body needs to then convert it into T3, and will require sufficiency of the enzyme IDI and really good phase 2 liver function in order to do that job properly. If we have elevated cortisol, if we have copper dominance, or if we have autoimmune disease, that can actually, T4 can convert over to reverse T3, which is inactive. So it's much more about, the whole hormone synthesis rather than just what's going on with the T4 function. And this requires, a good lot of patient education. And also looking upstream and looking, is the pituitary healthy and well? Does the pituitary have the minerals required to function well? The pituitary's, master mineral is zinc and manganese. The hypothalamus, again, zinc and manganese are really important for as well. Structurally, is the neck good? Is the blood flow to the hypothalamus and pituitary good? Look at previous history with car accidents and head trauma, etc., and have a look at what's going on upstream in hypothalamus and pituitary. So thyroid hormones are sensitive to levels of other hormones. And what I always will say to patients is that the endocrine system is just that. It's actually a complete system. So we can't just talk about your thyroid. We've got to look at what's going on with the other hormones that may be impacting your thyroid function. I liken it to a symphony orchestra. And the endocrine system is, I think, as complex and as beautiful as, a well-played piece from a symphony orchestra. We all know that that symphony is only going to sound beautiful if every single instrument is in tune. Likewise with our hormones. The moment you get one hormone is in dysfunction, you will hear that straight away. You will notice that when you're listening to that orchestration of music or hormones. So with thyroid hormones, they're really sensitive to estrogen. So estrogen, and especially too much estrogen, can partially block the efficiency of T4. Now, naturally, women do compensate by having a larger thyroid gland than men. And we produce more T4 than men to compensate for our natural, healthy, endogenous estrogen that we produce. So it is always harder for women to have an optimal thyroid function, especially given that we live in a sea of xenoestrogens these days. So really taking care of healthy estrogen production is absolutely critically important. Okay, iodine deficiency we've touched upon. We know that that's a really big problem in the goiter belt of the United States. So I think the first nutrient we need to really go into assessing is iodine. And we can do that through just a spot urinary iodine test, or just ensuring that we have sufficient repletion based on the recommended optimal iodine intake. And I've given you just a chart on slide 14 of the World Health recommendations of iodine for different ages and stages of life. Environmental toxicities always have to be a part of a thyroid conversation. We know heavy metal toxicity can trigger hypothyroidism, especially autoimmune hypothyroidism such as Hashimoto's. We know that lead and mercury are two really big heavy metals that are implicated in thyroid toxicity. So we need to do an assessment somehow, mineral hair analysis or a chelation challenge, to really understand what the implications are and how we can effectively detox those metals and optimize thyroid function. So mercury is a big one. We all know the sources, amalgams, etc., has a detrimental effect on the retina, kidney function, thyroid function, and it's a major mineral associated with autoimmune disease. And if you're selenium deficient, this also potentiates the toxic effects of mercury. So there's other heavy metals, and I don't have the time to talk about all of the environmental impacts in depth today. It's just a little bit of a snapshot and ideas of where you need to be looking. Now, thyroid disrupting chemicals are all around us every day. There's more than 1,000 chemicals that have been shown to alter endocrine function. They're in our food, they're in our water, they're in our skincare products, they're even in, some pharmaceutical medications. So I really urge you to utilise the incredibly valuable resources on the Environmental Working Group's website to help with patient education. I refer to that website literally every day for people to become aware of environmental toxicity. Another really, really good resource for your clinical practice is one of my favourite books, which is called The Toxin Solution by Dr. Joseph Pizzorno, who is a Bastyr qualified naturopathic doctor and one of the pioneering naturopathic doctors in the United States. He was recently out here in Australia presenting an incredible conference on the toxin, environmental toxicity and the impact. So that book is a really practical guide of what are the toxins, how do we avoid them, and how do we encourage our body to detox them safely. Okay, so in 2014, the Environmental Food Safety Authority reported more than 103 pesticides that specifically had thyroid disrupting properties. So if you want to resource that clinical paper, you can see that link down on the bottom there. I really do encourage that you maybe download that paper from the internet and have a really thorough read of that. Okay, so thyroid disrupting environmental chemicals can impact our iodine uptake, hormone production, conversion of T4 to T3, dysregulation of T3 over to reverse T3. It can impact cellular uptake of T3, cell receptor activation, and hormone degradation and elimination. So it can impact from so many different pathways. Okay, and the environmental agencies have, linked problems like flame retardants, PCBs, dioxins, phthalates, bisphenol A's, perfluorinated products as being some of the major ones being implicated. So we need to be aware of the sources. On slide 21, again, this is really a patient education slide to make patients really realise that it's important to make the lifestyle changes to clean their environment up if they really want to have a healthy endocrine system and a healthy reproductive system. So this is the flow-on impact of how these chemicals affect our thyroid function. And again, slide 22 is hopefully for you a really valuable patient education resource about the particular chemicals and what stage of thyroid function they impact, and then our bioactivated food compounds that can have a positive and or negative effect. Okay, now the cortisol connection is a big one to talk about because good old-fashioned stress or elevated cortisol really plays a big role in stimulating more reverse T3 production, and also decreases our ability to even convert T4 to T3. Elevated cortisol also leads to an increased risk of autoantibodies and subsequent autoimmune thyroid diseases. So I always say the adrenals are the big brother and the thyroid is the little sister. So the thyroid can only be as healthy as really the adrenal glands are. So always, again, look back, check other hormones, check other glands and see how they may be impacting the picture. Let's now look at pancreas and insulin resistance. So we know that elevated insulin can trigger increased production of thyroid binding globulin from the liver, and this will make more bound hormone and less free hormone, which will result in hypothyroid symptoms that often go undetected. So if a patient is insulin resistant or has elevated insulin, there's no way the thyroid can function properly. So they get, compounding fatigue, and this is where the weight gain profile can come in. Here on slide 25, I've given you what I consider to be a good thyroid pathology workup. And this is something that I would hand to patients and say, make sure your doctor is checking all of these things, get these checked, bring them back to me, and we will do some interpretation. So as you can see, it's really important to look at, vitamin D and iron. Iron works with T3 intracellularly to optimize mitochondria and also DNA production. And if they're female, it's absolutely critical we check estrogen and progesterone levels as well. So I've given you the reference ranges for each of these tests, so that's a handy reference guide for you in practice to be able to look at any results patients might be bringing into you and interpret them efficiently so you can find where the problems are. I won't go through those. I do want to, however, just talk about reverse T3 quickly, because I know that this is something that even a lot of medical doctors don't get a lot of good education on. So reverse T3 is virtually inactive, only having 1% of the activity of T3. And being a T3 antagonist, it binds to the T3 receptor sites, therefore blocking the good impact of T3. And the normal physiological ratio of T4 to T3 is 3.3 to 1. So you should always have 3.3 parts of T4 to 1 part of T3. But if the reverse T3 is too high, it will block the effects of the thyroid function and therefore lead to a false impression when you're looking at TSH, T4 and T3 levels. If reverse T3, which is the standard medical blood test, if it's detected, then treatment is required. And how do we reduce it? Well, we reduce it by giving selenium, zinc, vitamin B6, B12, iron, vitamin D and iodine. All of these are required by the deiodinase enzyme and are responsible for good T3 production and utilization. It's also really critical that we reduce any elevated cortisol because it's a major factor involved in reverse T3 production. So reverse T3 dominance is often completely overlooked. If reverse T3 dominance is present, some medical doctors will actually prescribe a slow-release T3 hormone once adrenal exhaustion, glycemia problems and nutritional deficiencies and low or high sex hormones are completely ruled out. But slow-release T3 therapy is kind of the last resort, and often patients don't need to go there if we actually treat the underlying factors efficiently. Okay, so once again, that's just a snapshot of how we interpret thyroid function tests and how we actually look for reverse T3 dominance. Okay, let's talk about autoimmune hypothyroidism, which is Hashimoto's thyroiditis. It's the most common cause of hypothyroidism in areas of the world where iodine is insufficiency. So generally a low iodine causes a baseline hypothyroidism. But autoimmune, most common cause of underactive thyroid in areas where iodine is sufficient. Now, goiter may or may not be present, but what you will always find present is the presence of one or both of the thyroid antibodies, antithyroglobulins and the antithyroid peroxidase antibodies. Again, they're checked through standard routine medical blood work. Now, and once you see the autoimmune factors, we need to be digging into some, is infection a part of the problem? Is high cortisol a part of the problem? Is environmental toxicity a part of the problem? So we have a checklist of things that we need to be investigating. Now, hyperthyroidism is also the second leading cause of elevated cholesterol after a bad diet. And when T3 levels drop, the liver produces excess cholesterol and fatty acids and triglycerides in order to try and help the body produce more hormones. These are simple steroid hormones. So one of the giveaway signs is that hypothyroid patients can develop a yellow skin due to carotenoid or vitamin A precursors depositing in the skin when the liver can no longer store enough of it. So have a look at the colour of your patient's palms of the hands and soles of the feet. And if they are unusually yellow, you can suspect thyroid problems, but particularly a really low T3. Cognitive decline is a big problem associated with thyroid function. So the brain fog, just not being able to think clearly or, concentrate for extended periods of time, and also depression is a big factor associated with underactive thyroid function and how it impacts our brain. T3 is practically like a neurotransmitter. So thyroid hormone imbalances can mimic psychiatric disorders because of the influence of T3 on their serotonin levels. And serotonin is, of course, a neurotransmitter that's integral to mood and behaviour. So we can't have good mental health if we don't have beautifully healthy thyroid hormone function. So severe hypothyroidism can actually have symptoms similar to Alzheimer's disease, memory loss, confusion, slowness, paranoid depression, and hallucinations. And thyroid disease is, of course, one of the many treatable issues that can be investigated, treated, and ruled out before a diagnosis of Alzheimer's. The risk of hypothyroidism does increase with age, and by 60, 17% of women and 9% of men have overt hypothyroid disease. So that's all the bad news. Let's start to talk about the good news and the beautiful and powerful botanical medicines that we have in our dispensaries in order to help patients' thyroid function. And one of the most humble, simple, beautiful botanicals is bladderwrack, which is a seaweed. Now, it's a shore-dwelling seaweed, not to be confused with deep-sea kelp. It contains organically bound iodine, which is simply like an iodine mineral replacement therapy. But bladderwrack also has the capacity to help detoxify heavy metals at the same time. So it's a wonderfully helpful iodine replacement therapy herb and also heavy metal detoxification. One of my absolute favourite herbs is coleus, or Coleus forskolii. It has a similar effect on the thyroid gland as thyroid stimulating hormone, and the key active constituent is known as forskolin, and it catalyses the production of cyclic AMP. Now, the thyroid requires cyclic AMP as a secondary messenger to actually deliver thyroid hormones into the cells efficiently. And one animal study showed when we gave coleus, it produced an 8-fold increase in the secretion of thyroid hormone. So it's most certainly a powerful and valuable plant. It is, however, probably the most unpleasant tasting plant in our whole botanical dispensary. So I would highly recommend tablet prescribing only. Coleus also supports mitochondrial function, supports weight loss, supports cardiovascular function, can help lower cholesterol. So it is the absolute perfect herb for not only improving thyroid function, but improving also some of the other concurrent symptoms and issues that they may be experiencing, such as, cognitive function, weight gain, and cardiovascular implications. Okay, now again, another real favourite herb of mine is the mighty ashwagandha, the herb that will give you the strength of 100 stallions. Such a beautiful plant of Indian tradition. Now, the research shows that ashwagandha can boost T4 production up to 111% in a number of different clinical studies that we have. The T3 was also increased, but to a lesser extent. So this suggests that it has real thyroid tonic action and supports the gland itself. Now, I think that with a really deep understanding of ashwagandha, I feel that probably one of the ways that it actually exerts most of its impact is by having this adrenal support function. So it's one of the most powerful adrenal adaptogens that we have. So its capacity to regulate cortisol so beautifully then takes all that adrenal cortisol stress away from the thyroid, which then allows, I think, the thyroid to function optimally. So ashwagandha is always my go-to herb as my first port of call for thyroid problems. And it also boosts energy and it's beautiful for the adrenals. Now, bacopa is another great one. Bacopa is considered a thyroid gland tonic. It boosted T4 production in one clinical trial up to 41%, but didn't have any impact on T3, where with the ashwagandha had impact on both T4 and T3. Bacopa is, it's called Brahmi. It's one of the master brain tonics that we have as well. So it's really great to alleviate the brain fog that is so concurrent with thyroid issues. Now, some other really helpful herbs. Romania, one of my absolute favourites. It's anti-inflammatory. It's a true adrenal tonic, and it's also very, it's blood pressure friendly, I call it. So if they've got high blood pressure, Romania won't negatively impact elevating blood pressure at all. So I love this one as a baseline anti-inflammatory and adrenal tonic. Astragalus is also a herb I use a lot. It's heating, it's warming, and thyroid patients are often cold. It's an incredible general tonic to the body, so it supports the adrenals, it supports the immune system, it improves energy. But most importantly, if you're worried about any immune implications or they are autoimmune, then astragalus is a great consideration. My two favourite herbs, if patients are incredibly fatigued associated with their hypothyroidism or Hashimoto's, then I'll always go in with beautiful adrenal adaptogens. And again, eleutherococcus, it's warming, it's an adrenal adaptogen. Korean ginseng, again, warming and adaptogen in their function. So these are beautiful to help support the patients with, the adrenal element, but the fatigue and the cognitive fatigue associated as well. So just a recap of our botanical recommendations. Bladderwrack, it's a whole food source of iodine and also supports heavy metal detoxification. Ashwagandha is excellent for improving your production of T4, but conversion of T4 to T3 and reducing elevated cortisol or supporting the adrenal axis. And Bacopa, supported by in vivo studies, brain tonic, cognitive fatigue, and also a direct thyroid tonic. Now, we don't have time today to really dig in and talk extensively about overactive thyroid or hyperthyroidism, but I just still wanted to mention the two major herbs that we have available in our dispensaries for management of that, and these are bugleweed and motherwort. So bugleweed is directly thyrosuppressant. So I do not use that herb for any other condition in my clinical practice, but it works so beautifully when we do need it for the overactive thyroid patient. And motherwort is a really great plant to support healthy cardiac function. Often with overactive thyroid, you get the palpitations and blood pressure associated, and motherwort is superb. Now, for autoimmune thyroid disease, so your Hashimoto's or your Graves', it doesn't matter whether you're over or underactive with the autoimmune. We go in and treat the autoimmune Th1 to Th2 regulation. The major herbs that are most impactful and most valuable in autoimmune regulation is echinacea, hemidesmus, and burphurum. I'll always back those up with nice adrenal support with Romania and or licorice. Hemidesmus, burphurum, and echinacea are just an incredible, powerful trio for autoimmune disease, and quite easy to formulate up together. So they're the baseline support that we do. Now, let's have a look at our general nutritional medicine that we can use concurrently with our herbs to support thyroid and adrenal function. We need tyrosine, selenium, iodine, and zinc. We need vitamin D, B complex vitamins, and vitamin C. Iodine is stored by the thyroid gland, but very necessary to produce T4, but can also be bound to proteins until it's required to be used. So iodine deficiency through diet, one of the biggest global problems associated with underactive thyroid. So 150 to 300 micrograms a day is a nice gentle repletion dose. With autoimmune disease, we do need to be quite careful, because if we excessively prescribe iodine, then that can actually trigger more thyroid antibodies. So I tread very carefully with iodine repletion or iodine treatment in the autoimmune patient. And excess iodine can also lead to goiter. Similarly to low iodine can lead to goiter as well. Now, if you remember back earlier in our presentation today, we talked about the fact that, the majority, 80% of T4 in the bloodstream is converted to T3 in phase 2 liver pathways. Therefore, it's really critical to support healthy liver detoxification pathways. We can use silymarin or St. Mary's thistle or milk thistle, rosemary, schisandra, broccoli sprout extract, turmeric, glutathione, glycine, taurine, cysteine, methionine, choline, and inositol. Everything we know about to support phase 2 liver function really goes a long way in optimizing T4 to T3 conversion. So that's how we get a better T3 level in the bloodstream. Also, any degree of inflammation negatively impacts our mitochondrial function. So to optimize our mitochondria and optimize our DNA and RNA, we need to really support with the new gen antioxidants, which is the NRF2 primers. So these are a list of incredibly powerful therapeutic substances when you get inflammatory load or mitochondrial dysfunction. And one of the driving causes of mitochondrial dysfunction is thyroid problems. So our NRF2 primers are turmeric, rosemary, green tea, grapeseed, ginkgo, Korean ginseng, resveratrol, garlic, all the brassica vegetable families from anything that contains sulforaphane and, again, schisandra. So these are incredibly valuable therapeutic agents to really upregulate mitochondrial function and decrease systemic and neuroinflammation. Now, just a word on brassicas. We know that they're incredible, health-giving, amazing substances that are anti-carcinogenic, improve phase 2 detox, have NRF2 function, and this is all driven by sulforaphane, which is one of the most potent naturally occurring inducers of the phase 2 pathways. Now, one of the major components responsible for these effects is the breakdown product, which is the glycophyate. And for example, in broccoli, the major glycophyonate is converted to sulforaphane, and sulforaphane is the major driving therapeutic substance. Now, people often, are concerned about the goitrogenic effect of brassica vegetables, but in one study, the goitrogen dose of 70 nanomoles did not inhibit thyroid function. A dose of 194 nanomoles did inhibit iodine uptake. But generally, if you have cooked brassica vegetables, then that degrades the goitrogenic agents, which will then make them thyroid friendly. But at the end of the day, you would need to be consuming a fair bit of raw brassica in your diet to be even concerned about this. So the highest containing, most valuable brassica vegetable in terms of sulforaphane content is the Russian kale and Brussels sprouts. So these ones definitely need to be consumed cooked. But commercial broccoli, for example, curly kale and all your Chinese and Japanese greens and turnips contain only less than 10 nanomole per gram fresh weight of the goitrogenic agents. So the take-home message for patients is don't worry about it, but if you're eating Russian kale or a lot of Brussels sprouts, just make sure they're cooked. And I don't know many people eating a lot of raw Brussels sprouts. So it's unlikely that a single serve of any brassica will have a goitrogenic effect in any, adult human. So excessive consumption, and that is more than a kilo of raw brassica vegetables every day for several months, particularly if it's Russian kale or Brussels sprouts, may lead to a problem. So the reality is, even if you had 2 or 3 types of brassica vegetables cooked every day, you're perfectly fine. So cooking decreases the goitrogen content. Okay, now one of the parts of our thyroid conversation that I really wanted to have with you today was considering the gut. Now we know autoimmune disease, yes, absolutely consider the gut, but we don't automatically think, oh, hypothyroidism, let's consider the gut. Now there's been quite a lot of research being done in Australia here by microbiome specialist, Professor Jason Horolek, and he's made quite a quantum discovery that's also been published in journals of parasitology about the growing body of evidence suggesting that a parasite by the name of Blastocystis hominis can be implicated in Hashimoto's thyroiditis. Now, you can test for this agent with a fecal PCR multiplex test, and there's great labs, of course, Genova in America is one of them that will do this fecal parasitology test for you. That's done over 3 days to detect the presence of this particular little parasite that can lead to then production of thyroid antibodies and the onflow effect of Hashimoto's thyroiditis. So Blastocystis is a single-celled enteric protozoan that is known to be present worldwide. It is a common parasite isolated from human stool samples in developed and developing countries, and rates of infection vary from 3.3% in developed countries to 53.8% in developing countries. Here in Australia, it's actually quite common in our general water supply. So I see this parasite coming up positive day to day in my clinical practice. I routinely test for it for every single patient these days. Patients may not necessarily have like gastro-type symptoms associated with it, where some will. So there is controversy in the world of gastroenterology as to whether this is a pathogenic protozoa or whether it's a pathogenic or just a common zonal protozoa. But when we see it linking to autoimmune disease, I very much consider it to be pathogenic. So how do we deal with this problem? Well, fortunately, botanicals work brilliantly for management of blastocystis. When you see it in your Hashimoto's cases, also look for it in your Graves' disease patients or any autoimmune patient for that matter. We use the classic Terry Bone weed and feed treatment protocol, something that I've been using in my practice for my whole 20 years. So we use our anti-pathogenic gut herbs, philodendron, ribwort, myrrh, sweet wormwood, oregano oil, nigella, cinnamon, thyme, grapeseed and garlic. You don't need to use all of those, but a combination of those in the weed and feed treatment protocol go a long way to treating. Now, I generally would treat this for 12 weeks before then going into retest with another stool sample. We also need to get plenty of prebiotics into their gut, and this is lactulose green tea and partially hydrogenized guar gum. And then, of course, treating with probiotics. The specific strains are, Lactobacillus acidophilus LA5, Rhamnosus GG, Bifidobacter, BB12 strain, Saccharomyces boulardii, or the SB strain, work incredibly well. There's been a clinical study that was published in the Journal of Parasitology in 2011 looking at a particular bicodex strain of Saccharomyces to effectively treat blastocystis in children. 10 days of administration of the Saccharomyces resulted in a 78% clinical cure rate in the children and 72% of parasites cure rate at 15 days. So the Saccharomyces is an incredibly valuable therapeutic agent in addition to our herbs, our prebiotics and our probiotic therapy. Okay, so to wrap up and summarise everything that we've talked about today, I wanted to give you a key therapeutic recommendations guide. So for hypothyroidism, our primary focus is going to be bladderwrack, coleus and ashwagandha. When we have cognitive impact, I always love to use bacopa. And when we have fatigue and adrenal impact, eleutheroid, panax ginseng, romania and licorice. If they're an autoimmune Hashimoto's patient, then we need our immune modulators, echinacea, hemidesmus, biflurum and astragalus. We still need to back up with good adrenal support, licorice and romania. With our hyperthyroid patients, our primary herbs are bugleweed and motherwort. And also I get patients to drink tea of lemon balm. Lemon balm is another beautiful thyroid-suppressant herb when you take it frequently, and that's actually a herb that's water-soluble, and you can buy that as a herbal tea in any good like whole food markets or health food stores. So a nice pot of lemon balm tea every day for the hyperthyroid patient. And then for autoimmune, overactive thyroid or Graves' disease, we then need to add the autoimmune level with echinacea, hemidesmus, bifidum and astragalus, and good adrenal support with licorice and romania. Thank you so much. That comes to the end of our formal part of today's presentation, and I always love to give gratitude and thanks to my mentors and teachers who educate me and help me put some education together for you. Associate Professor Kerry Bone, the beautiful Beres Burgoyne, and Dr. Jason Horoleck. Thank you so much.